viewers, welcome again to another episode with Dr. Vyas.
Hello everyone, my name is Dr. Vyas. I'm a senior consultant physician and specialist in cardiology and diabetology.
Welcome, my name is Benta Terry. Welcome, Doc.
Yeah.
As a senior cardiodiabetologist, today I want us to discuss about diabetes type 2 specifically. There is insulin. One of the treatments for diabetes type 2 is insulin.
Yes.
Now the first question could be, is insulin the only treatment for diabetes type 2?
No, insulin is not only the treatment. Insulin is the treatment which we use when the sugar is uncontrolled. Okay. But there are specific criteria for that, especially for type 2 diabetes patients. One of the criteria is when the HbA1c value, the 3 months average blood sugar value, if it goes beyond 9, that is one of the indications for treating type 2 diabetes with insulin. Okay. The second criteria is the patient should be losing weight, or we call catabolic state. Okay. In that case, we start insulin. And also patient comes to you with a very bad infection in a very bad clinical status, with very high amounts of blood sugar and possibly ketones present in the urine. Okay, these are the conditions in which we start insulin. Insulin is not for everybody, but for specific criteria in type 2 diabetes.
Okay, at least not for everyone. And is insulin, how is insulin taken?
Insulin is given subcutaneous, either by pre-filled pens or by using insulin syringes.
Is it automatic that when the patient is given the pen, they will know how the medical staff will teach them, show them how to use it?
We usually teach them in the clinic before they go with the prescription.
And do we have any types for insulin?
Yeah, there are many types of insulin.
The most commonly used?
Based on from where they are produced. Previously, we used to have bovine and porcine insulin. That is, these insulins are derived from animal sources. Okay. Later, the technology these are the initial insulins that we used. Later, what happened is the technology progressed, because these animal sources, they were developing insulin autoantibodies. Patients are developing insulin antibodies, and they are not very effective. Okay. So later we started producing recombinant insulins by gene splicing techniques. So by changing the genes of some bacteria, the bacteria started producing human insulin, and that we collect and we started using it. So this is recombinant. And now the latest insulins these are manufactured insulins. Like they take the insulin maybe from the recombinant animal, recombinant bacteria, or they manufacture using the specific techniques. Okay, so these new insulins, they are not insulins per se, they are called insulin analogs. Okay, so by changing certain amino acids in the insulin sequence, they're able to manufacture insulin, what you call tailor-made insulin, so that the insulin either works for a very long time or very short time. So these are the three main types based on the origin from where we are getting the insulin. Okay, and based on the time they act, insulins can be classified as ultra short acting, medium acting, long acting, and ultra long acting.
Okay. Yeah. Now the first question was about who is supposed to get insulin, right?
Yeah.
Like not everyone. At what point in? At what point? That's when you say that when your
HbA1c above 9 and showing catabolic state. These are the most important things.
I used to, most of us, I believe, used to think that insulin is used maybe as per age.
No.
But now at least that is clarified.
Yeah.
And are there any, what are the benefits of insulin as a treatment for diabetes type 2?
Especially in these conditions where I told you, HbA1c above 9 and catabolic state, patient has already lost weight. Yes. So usually insulin treatments make you gain weight. That is one thing. And insulin treatment also is important when the oral agents are unable to control the sugar. Okay, we are already exhausted all classes of oral hypoglycemic agents, and the sugar is not getting controlled. That's when we start insulin. Especially in type 2 diabetes, what happens is when we start the insulin treatment, the pancreas gets rest. Okay, pancreas gets rest and it recovers, and whatever the residual insulin activity that is produced by pancreas is there, that gets restored. Usually for any type 2 diabetes, most of the type 2 diabetes patients, I don't use insulin more than 1 or 2 months. By third month, usually they are back on tablets.
So you wean them off insulin.
Yes.
And when the patient is using insulin, though, are there any lifestyle changes that comes with the usage of insulin?
Whatever,
or could I say side effects?
Whatever the changes whatever the what you call lifestyle changes they have done when they are on tablets, what is necessary for diabetes treatment, diabetes management, the same things they have to do for insulin. Like eating on time, taking small portions, decreasing the carbs, increasing the proteins and fiber in the meals, absolutely no sugar in any form. So these are the general guidelines which any diabetic has to follow. The same thing applies to insulin.
So nothing changes much. It's only the treatment ways. And what is the longest time you've put your patient as a diabetologist on insulin?
Maximum 3 months. Maximum I put was 3 months. Especially I'm telling type 2 diabetes.
Yes, type 2.
Not type 1. Type 1 they need insulin lifelong. So type 2 diabetes patients, maximum I put them for 3 months. That is also in rare cases, not in everybody. In most of the cases, by second month half time or second month ending, insulin is off.
Okay. So could you recommend, as a diabetologist, could you recommend insulin for those uncontrolled sugars?
Uncontrolled sugars despite taking all classes of hypoglycemic agents.
Because the benefits sound like they are more.
With insulin the treatment, what happens is getting the control of diabetes is very fast. Okay, that is one of the reasons why we use insulin. Once the patient is under manageable levels with tablets, like under 8 levels, under HbA1c 8% levels, we usually stop insulin.
Look, what if you get a patient who has all the symptoms, like has everything that is eligible for insulin, but they say no?
We encounter many patients, unfortunately. We try to counsel them a lot, and there are still one or two patients, stubborn people are there. So we'll try the newer therapies like imiglamin, but it's not very effective. Insulin is better.
Insulin is effective. Have you encountered any myth?
The myth about insulin treatment is that this happened because of the olden days. Okay. When we were using olden types of this recombinant insulins, when we were using Novorapid and Mixtard, not Novorapid, sorry, Actrapid and Mixtard, we used to give insulin for a pretty long time because those insulins, they did not mimic the natural pancreatic insulin secretion. Okay, the newer insulins, the insulin analogs which we give them in such a way that the insulin treatment mimics the pancreatic insulin release pattern. So because we are mimicking it, pancreas is getting the rest and it is getting recovered. Especially in certain people, the sugar tablets, the sugar oral medicines like sulfonylureas, they cause something called beta cell burnout. Okay, this is one of the main reasons for occasionally patients' control going off despite it was being okay in the initial stages. Okay, this beta cell burnout, because sulfonylureas work on the beta cells which produce insulin, and these beta cells are overworked because of sulfonylurea. Sulfonylurea stimulate beta cells to produce more and more insulin. Okay, especially older oral hypoglycemic agents such as glibenclamide, they cause beta cell burnout. And patient comes with a bad insulin status. So these kind of patients, what we do is we stop glibenclamide, put them on insulin, insulin analogs. They recover, and we switch them back to tablets again.
Okay, so what is the myth?
The myth is that in the olden days, Mixtard and Actrapid, when we were using, we used to give for lifelong in many patients. Now it is no more. There is a paradigm shift in the way we treat diabetes. So the way we are looking at diabetes medicines is also totally in a different perspective. So insulin is not required for lifelong. Once you start insulin, you have to take for lifelong is a very big myth. Okay.
Yeah, sure.
And insulin, one more myth the patients usually, especially Indian patients, they say is that I'll get used to insulin, I'll get addicted to insulin. No, it's not like that. Insulin is like a natural substance which is produced in the body and you can never get addicted to it.
And I think it's not only Indian patients. I've heard also that around. That is why most of them actually decline. That is one of the major reasons, and also because it's a needle. Like you have to keep on.
But with the pens, actually, you don't feel any pain.
That's interesting.
The pens needles are very ultra fine needles, and you don't feel any pain.
Good to know, Doc. That was so much educative. Thank you.
Yeah. Thanks a lot.
Thanks.
If you had liked this video, please like, share and subscribe.